Chickenpox is a notorious childhood disease that many children are exposed to. Although extremely uncomfortable, there is usually a bit of relief. That is because it is believed that if you contract chickenpox once, then you won't ever get it again. Well, not quite so. There is an illness that can be triggered by the same virus that causes chickenpox. Adults, especially the elderly, are most vulnerable to developing it. This week's Healthy Living looks at the painful and uncomfortable condition known as shingles. If you have ever been infected with chickenpox, then you're automatically at risk for developing shingles. According to internist Dr. Daniel Godinez, shingles is a viral infection caused by the same virus that causes chickenpox.
Shingles is a condition that appears only on people who have suffered chickenpox before.
Okay.
So for you to develop shingles, a requisite is that you must have had chickenpox sometime earlier in your life. Once you develop chickenpox, the virus that causes it really is not completely destroyed by your body, but it goes dormant into your nerves. So the virus can stay there for years dormant, and whenever any situation that weakens your immune system appears, then the virus can flare up.
The virus is called the varicella-zoster virus. When it flares up in adults, it results in a distinctive, painful rash called shingles. Not everyone who's had chickenpox will develop shingles. The main trigger is a weakened immune system that can be caused from sickness or stress. The elderly are also more susceptible.
Shingles is a condition that happens usually in patients of middle age or elderly. Although really shingles can happen at any age, but certainly it's much more common as you cross the line of 50.
But what does a person experience when affected by shingles? Other than the distinctive blisters that wrap around the side of the waist, the main description is usually pain.
Since what shingles affects mainly is the nerve, and obviously the nerve is very sensitive, it's very much like if you are almost pinching a nerve. That is the kind of pain that the patient will experience. Nerve pain is one of the most intense pain that a human can experience. The typical evolution of shingles is that first there is pain in the area where the shingle is going to appear. Then 2 or 3 days later, the blisters appear. And about 1 week later, these blisters start drying up and they form scabs, scabs made out of blood. So they look dark. The whole process can last about 3 weeks, and of course it's very painful. The individual is infectious during the time that the blisters and the scabs are present.
For some persons, the pain of shingles may last for months or even years after the blisters have healed. This is because of damaged nerves in and beneath the skin. You cannot catch shingles from another person, but it is contagious. In fact, because they're caused by the same virus, contact with a person who has shingles during the time of blistering can cause someone who's never been infected before to catch chickenpox. In terms of prevention, trying to keep a strong immune system is a start.
It has been proven that getting supplements with vitamins or eating plenty of fruits and vegetables, which also have vitamins, can decrease the risk of you to develop shingles. And the theory is that these things will boost your immune system. Also, elderly patients who get exposed to children who have chickenpox, they get a boost out of the exposure, and so they decrease the risk of developing shingles also. In the past, we used to think that shingles was a relatively harmless condition, but now we know that it can really lead to serious complications, including infections of the brain, occasional death, seizures, and also the most common thing is the fact that many patients are left with severe pains in the area where the shingles appear that can last up to 1 or 2 years after that.
Treatment includes antiviral and anti-inflammatory medications and pain management. The earlier treatment is administered, the lesser the effects. In some parts of the world, there is a vaccine for elderly persons to prevent shingles. That vaccination is different from the chickenpox vaccine for children.